Laboratory fellow puts COVID-19 tests through the paces. For many years, Jessica Prince Guerrera has been passionate about combining laboratory science and public health to make a real-world difference in fighting infectious diseases. Her career has taken her to Ecuador, where she learned firsthand the importance of laboratory work in improving a community's health. She also witnessed health inequities that motivated her to devote her career to public health. She earned her PhD in microbiology and molecular genetics at Emory University, where she sat out a project that, in her words, didn't keep me in a lab. I wanted to connect to communities that were affected by the disease I was studying. She continued conducting laboratory fieldwork in Zambia, Guatemala, Bolivia, and Mexico. She says, "My international experience has taught me to expect the unexpected, troubleshoot problems quickly, organize field teams, work with diverse communities, and the importance of ensuring culturally and linguistically appropriate communications within communities. Little did I know that was preparing me for the pandemic." In July of 2020, as COVID-19 was spreading across the globe, Jessica joined the CDC's Laboratory Leadership Services, or LLS, as a fellow to begin her disease detective training. One of the things that drew me to the LLS program was having the opportunity to be on the front lines of the public health in a leadership role. This work has affirmed my passion for public health and helped me develop my skills as a leader. But in September, the CDC's COVID-19 emergency response needed Jessica's lab expertise. Arizona and Georgia had asked CDC to help them evaluate the antigen test, which was being distributed by the federal government. The test had received Emergency Use Authorization, or EUA, from the FDA for use in people who were experiencing symptoms. Jessica says, "We didn't have a lot of data on how well antigen tests performed, particularly in people who don't have symptoms." Antigen tests detect proteins from the virus in samples from people who have COVID-19. To date, 13 antigen tests have received the EUA, and most can deliver results in about 15 to 30 minutes. However, public health officials need to understand how antigen tests perform and when to consider using more sensitive, real-time, reverse transcription polymerase chain reaction, or RT-PCR tests, which look for presence of the virus. Jessica says, "I found it exciting to work with the Arizona team from start to finish. Working with health department employees, being able to communicate with Spanish speakers, writing fact sheets for the public, and analyzing the data, it felt good to be part of a project that was helping the community." Her job was to compare the antigen tests to the real-time RT-PCR testing, considered at the time the gold standard for detecting current infection from a virus, like the one that causes COVID-19. But real-time RT-PCR tests require specialized equipment and technical skill to perform. Communities with widespread transmission need fast, easy-to-use tests that can be performed without highly technical equipment. These tests could help states and others, like colleges, reduce their testing costs, isolate sick people sooner, and start contact tracing quickly. Jessica deployed to both Arizona and Georgia. In Tucson, Arizona, she led a team that tested 3,400 residents with and without symptoms over a 2-week period. Jessica's team discovered that the antigen test yielded a few false positive results, meaning that, for most samples, a positive antigen test result accurately detected when a person had COVID-19. Jessica's team learned that the antigen test correctly came back negative for most people without confirmed COVID-19 disease. However, for people who were positive by real-time RT-PCR tests, the antigen test was correct for 2 out of 3 samples from people with symptoms and was correct only for about 1 out of 3 people without symptoms. A CDC morbidity and mortality weekly report describes results from Arizona. Although the antigen test didn't perform as well as health officials had hoped, the results will help public health officials decide how to best use the antigen test and whether or when to use real-time RT-PCR testing to confirm results. During Jessica's Georgia deployment, she was part of a team that tested more than 2,000 students and staff at a college over a 4-day period. Results from the Georgia evaluation will be published in the coming months. Jessica says, being in the lab all the time, you don't always have a full appreciation of the human component of the work that you're doing. Going into the field, I was in testing centers hearing people's personal stories, which was very impactful for me. All different walks of life, each person with their unique situation and story plays into public health decisions in one way or another. Jessica holds out hope that her work will help the country be in better shape as 2021 unfolds. She says, I think I'm in public health. We have to be cautiously optimistic here. Because if you don't have optimism about things getting better, it's hard to see the light at the end of the tunnel and hard to keep moving forward.